Yeah, and Bill, on that vaccine front, with the caveat that this is early information being put out by one of the manufacturers behind that vaccine, but Richmond and Henrico County Health Director Dr. Danny AVULA says it is welcoming news and he is gearing up for the eventual rollout.
The fact that it does look pretty compelling.
The initial reaction from Richmond and Henrico Health Director Dr. Danny AVULA about early results from a COVID-19 vaccine trial run by the drug company PFIZER. Monday, the company said it's more than 90% effective. AVULA says that's better than a flu vaccine.
An efficacy of 90% puts it more on par with things like measles.
The trial has nearly 44,000 volunteers, with some getting a placebo, others getting the vaccine. This early study was conducted after 94 participants contracted the disease.
The other good news about what's happening with the Pfizer trial is that they have not had any serious side effects.
AVULA says if the effectiveness remains that high, it will help with developing herd immunity.
We still want to vaccinate large numbers of people, but it does mean that we don't have to vaccinate quite as many as we would if the vaccine efficacy was only 50 or 60%.
AVULA cautions, though, that rate could change, and there are still other unanswered questions.
We have no idea how long any kind of immunity from vaccination will last. Is this something that people will have to go back and get every year?
Pfizer says it plans to apply for emergency use authorization with the FDA near the end of November and have 50 million doses ready worldwide by the end of 2020. AVULA says that healthcare workers in long-term care facilities will get priority for the first batch, and his department will likely be involved with community vaccination events in the spring.
When there's more vaccine available and we can identify some of the higher risk groups, the elderly, folks with underlying health conditions.
Now, as for the statewide efforts on rolling out the vaccine or vaccines that are approved, you may remember the state health department sent their proposed plan to the Centers for Disease Control and Prevention last month. They tell us today that they have gotten that plan back from the CDC with feedback, and they are working to incorporate that into their plan, but they don't have their updated version quite done. Working for you in Richmond, Cameron Thompson, CBS 6 News.